It is indeed possible. And all of the member states of the UN, in fact, committed to an AIDS-free generation last year at the high-level meeting on HIV. The reason that I say it's possible is such dramatic progress has occurred in the past decade. For example, we've gone from virtually no one in need of treatment receiving it 10 years ago to over half of all adults throughout the world that need treatment receiving it. But when we talk about an AIDS-free generation, I think we really need to address the fact that a new generation free of HIV, free of AIDS, must begin with children. Children, mothers, fathers.
But you say that it is possible, and yet there's still a tremendous number of children who are not receiving treatment and who are not being tested.
Well, when we talk about new infections in children, infections due to mother-to-child transmission, either while the woman is pregnant or during delivery or during the breastfeeding period, we really have achieved quite incredible progress. 330,000 children born throughout the world with HIV last year. That's 330,000 too many. But even compared to 2009, 2 years before, when 430,000 children were infected, we've seen a 24% drop. If we go to the peak of new infections in children back in 2004, we saw close to 600,000 children born with HIV. So the decline is dramatic. The goal is to eliminate new infections in children by 2015. If we continue on course and if we make the kind of programmatic innovations that need to happen, we certainly can eliminate new infections in children by 2015.
Now that's the key point, isn't it? That you're talking about eliminate for the first time. Why is that? Why have you changed your language?
Well, eliminate sounds a lot better than reduce, for sure. There is, of course, a particular language associated with elimination and a process by which you have to validate in an ongoing way, because you will never reach zero infections in children and then there'll never be another one again, because there will always be, hopefully not always, but for the foreseeable future, there will be people living with HIV, women living with HIV who may get pregnant and without treatment have the possibility of transmitting HIV to their infants. But when we talk about elimination, technically we mean a 90% reduction based on a 2009 baseline figure I mentioned of 430,000. So we're looking for 40,000 maximum children around the world infected with HIV by 2015. So we essentially need to go from 330 last year down to 40 by 2015. And why I say it's possible, it's actually been done in high-income countries where we've been testing pregnant women as part of their routine antenatal care for many years and offering treatment to the women living with HIV, both for their own health and to prevent transmission to their babies. We see virtually no infections in rich countries in the world. And many middle-income countries now in Latin America are beginning to come forward to say, we think we've achieved it. WHO is putting in place a process to validate it. And here at UNICEF, our primary role is assisting countries to scale up the programs that need to happen to prevent mother-to-child transmission, to treat the mothers living with HIV and fathers, and to integrate much better HIV services from standalone services to using the antenatal care, the maternal and child health platform, to really integrate HIV services with other routine child and maternal health programs.
If you look back a few years ago, I'm sure you remember, I know I saw it, in small villages, in small countries, you'd have more than half of the population in those villages affected in one way or another. Either they'd lost a parent or a child or a father, someone in their family, and it was just actually threatening the entire future of that very nation, a country like Swaziland, Lesotho, Botswana. Do you really think that taking the experience of what's happening in high-income countries, industrialized countries, that it is possible to get to a point in those countries like Swaziland, Lesotho, Botswana, whose very existence was threatened as a result of HIV and AIDS?
Well, in fact, I've been working in this area now for close to 30 years, and you're absolutely right. Only a few years ago, you would travel, particularly in southern and eastern Africa, the countries hardest hit, and you would just see devastation all around. Since the advent of treatment in the late 90s and the introduction of treatment into poorer countries in the past decade, beginning around 2002, it's just amazing the difference that you see in terms of families that are living with HIV, many members, but productive, engaged, working, healthy, all because of treatment, but also the programs that have been put in place to prevent HIV transmission. Condom promotion programs, programs to prevent mother-to-child transmission of HIV, targeted approaches at the communities most affected. Male circumcision, as proved in heterosexual generalized epidemics, has proven to be an enormously effective intervention, about 50% effective at preventing transmission from women to men. So all these tools that we have at our disposal, all this proven evidence has been put into action in the field since resources began to flow through the Global Fund, through the US PEPFAR program and other donors. And organizations like UNICEF in the area of children really play this critical role to ensure that kids that are affected by HIV, that you referred to, have programs to mitigate the damage done from being an orphan, the economic damage, many programs in place there, but also the testing services, the treatment services to identify those that are living with HIV, get them on treatment, and these prevention services I talked about earlier.
But if you look back, would you have seen a moment maybe 10 years ago when all this work started that you would get to this point? What does it do to you and people who are working so closely on trying to eliminate HIV and AIDS?
Well, when I look back there were two incredibly exciting moments in quite a dark 30-year history of the epidemic. One was in 1996 when at the International AIDS Conference, treatment using 3 separate drugs was shown for the first time to hold back the virus from reproducing and keep people alive. The second was in 2003 when WHO and UNAIDS, along with other UN and community partners, launched the 3x5 initiative with the aim of treating 3 million people by 2005, beginning from virtually nothing. Now we have well over 8 million, and as you say, we have a world that's committed to ending AIDS, a number of ambitious targets by 2010, cutting new infections in half in young people, eliminating new infections in children due to mother-to-child transmission, and achieving universal access for all people who need it, children and adults, to treatment. So this moment in time, I think, is the optimism is palpable. The challenge, of course, is will the world continue to have the same focus, give the same resources? And when I say the world, I mean the countries most affected, but also the donor countries, to remain focused, to realize that the end can be near, to realize there is still unfinished business as well. I mean, we still have enormous amounts of work to do in relation, for example, with the most marginalized communities that are affected in many countries in the world. Young men who have sex with men, drug-using populations, and people exploited by the sex industry, working in the sex industry. These are difficult populations to reach and really require efforts beyond the health sector that focus on protection of human rights, identifying, it's really the equity agenda that is the unfinished business, making sure that everyone has access to these tools to prevent and treat HIV.
Now, you mentioned unfinished business, and this is a critical time, isn't it? Because the fear must be that with this extraordinary sense of optimism and this momentum that you now have, that there'll be a sense of letting go, that we're almost at the end, so it'll sort itself out. Like any epidemic, it'll eventually just wind itself out and it'll be sorted. So isn't there a great fear that you could just slip back at this stage?
There's always that fear, but I think there are some good signs that counteract that argument. One is that people working in HIV have realized in the past few years that we've got about as far as we can go with vertical standalone programs. The way forward is trying to integrate HIV services, whether it's prevention services, testing, treatment services, into other health platforms. For example, the maternal and child health platform I spoke about earlier, but also reproductive health platforms where people go, particularly younger people, for access to information about sex, access to information to prevent unwanted pregnancies, and then also schools-based integration of HIV into broader sex education in schools. So really the way forward, I think, is around taking HIV out of isolation, it's often called, and integrating it with the other areas of development work that continue and that are being strengthened. A lot of people talk about health systems strengthening now, that we've put a lot of money over many decades into vertical disease programs. Those have paid off in terms of lives saved, but now we need to leverage the strength, the power, the incredible success of those programs to make sure the systems in place become stronger and are more sustainable.
You talk about funds, but surely there was something much more fundamental that took place as well, because it's never just about money. What was it, if you can look back over this last 10 years, the worst time of the epidemic, what do you think it was that kind of brought all these elements together and you thought this was the turning point? You know, has that been reached, and if so, what were those elements?
The turning point globally and in countries has always been when leaders have recognized that the problem exists and have begun to speak out openly about it. If I use the example of the country where we are today, the United States, it was many years before the then President Reagan uttered the words AIDS. So it took really until the end of the 80s before the problem was really recognized in this country. In Africa, in South Africa, one of the most impacted countries in the world, more than 20% of the population is living with HIV in South Africa. There, really, it took until the last decade, under current President Zuma, to stop the conflicting reports about whether HIV caused AIDS, whether the drugs worked or they didn't work, and started to embrace the science and the clear evidence and make a difference. So the leadership that was shown in South Africa beginning a few years ago has now translated into incredible results in that country. Infections going down, people are on treatment, prevention of new infections in children is moving ahead faster than anywhere else in the continent. So it comes down to leadership. I think leadership, willingness to speak out openly, willingness to tackle the problem, and willingness to face the fact that, yes, it's a disease that's primarily driven by sexual activity, by drug use, and these are difficult, sometimes politically difficult, taboo, personal issues. But in fact, a disease that spreads that way is not just going to go away until that recognition is made. So it was that turnaround that happened once countries began to speak openly, once leaders began to speak openly about the disease and about the impact it was having on their people.